Again, with an increase in viral illnesses across the country, more people are going to emergency rooms with COVID-19. Hospitalizations jumped about 17% in the most recent week. Then there's the flu, with more than half of U.S. states seeing high or very high levels of influenza. So far, there are 7 million confirmed illnesses, 73,000 hospitalizations, and 4,500 deaths, all related to the flu.
Now, Arkansas is in the very high transmission category. So far, that state has reported 14 flu-related deaths. Missouri remains here in the moderate category. And if we drill all the way down to Greene County, you can see how cases have grown since October. A total of 414 cases this season, 101 new ones in the past week. Michael Hoffman joins us live on Medical Mile in Springfield with a look at the impact these flu cases have had on local pharmacies. Michael.
Well, Paul, believe it or not, pharmacists are telling me that they're moving away from prescribing the Tamiflu-type medications, moving more towards the antibiotic and antiviral medications. They say they're a little bit more worried about RSV at this point, adding that they're seeing patients moving away, more towards preventative care rather than reactionary care. But they still say a lot of people are still getting sick. Meet Grant and his parents, Jessica and Sam Pond. A few weeks ago, Grant got an infection. It spread to both of his parents.
My whole family was sick.
Jessica and Sam both were treated for strep throat. It's one of many infections floating around town. Jessica says it had them down for the count for weeks.
We were sick for a total of about 14 days. It spread so quickly, and we're lucky because I get to stay home with my son. He's not in daycare or anything like that, and we still get sick, right?
The Pond family is not alone. Many have been filling prescriptions at pharmacies like this one, although what they're buying is different than what you might think.
I think we're kind of turning a curve to more preventative than the retrospective.
Pharmacist Tom Mingwasser says they're selling COVID and RSV tests, antiviral and antibacterial meds, as well as some over-the-counter immune boosters.
It's taken a good swing from a therapeutic standpoint. Generally treatment is retrospective. Now we're getting a lot of people that are like, I came in contact with someone that had it. What do I do? And so then you can lead them to the, boost your immune system, get your vaccines. And so I think it's a good thing.
Mangwasser says you should do your best to avoid the doctor's office altogether.
It all kind of start with drinking lots of water. That's the first place I'd go. Second place I'd go is upping your vitamins, making sure you're on a vitamin, a 1-a-day vitamin, just a good one of any kind. And then if you are, then up the zinc and the vitamin C levels.
When it comes to the Pond family, they're all healthy now and looking to keep it that way.
If you get sick, let everyone know that you've been around for the last week maybe, that you're sick and having these symptoms. I think just communication with other families and friends that you're around to warn them if they've come down with anything and to try to help prevent.
Mangwasser says the general attitude that we all got about being sick during the COVID-19 pandemic, in his opinion, he says it might actually be what's driving this preventative care movement. More people wearing masks like these, more people getting vaccines, and more people informing their friends when they're sick means more people care about staying healthy and making sure their friends and family do so too. For KY3 News, I'm Michael Hoffman. Back to you in the studio.
Thank you, Mike.